Joining me now is Dr. Mirro, the Chief Academic Research Officer. Hi, Dr. Mirro.
Hi, Jessica. Thank you for being here today.
I'm so happy to be here. So we are talking about the Mirro Center in a whole new way. Of course, our audience is aware of the facility in the conference room being used for nonprofit events and conferences, but you actually have this whole innovation research lab behind that really started this whole facility. So please give us the history of the Mirro Center.
Yep. Well, the background of this is how do we improve patient care in Northeast Indiana. And many years ago, we started conducting clinical research studies to bring new therapies to patients, specifically drugs and devices to help improve care. But as time evolved, our past president, Mike Packnett, had a vision, how could we enable this to be a much bigger concept? So the concept was to conceptualize the research entity as a building and also have a health service informatics team, which would look at data science as well as clinical research, but also build around it patient education, professional education with an advanced simulation center, and also an innovation center to bring new technologies in and test it. At the center of this concept is the patient. How can we improve patient care? So over time, this team has built an incredible amount of work that's been done, not only within Fort Wayne, but now well beyond its borders, not only nationwide, but globally, in bringing in technologies and actually helping early stage companies test new technologies in healthcare. It's been very successful, and we're really very proud of the work of the team.
Yes.
So the center just enables that. It's a place to help enable that to happen.
And as we walked around and looked at the simulation lab and looking at the models of the bodies and all of the technology that's advanced to help researchers and help those in the medical field really continue their studies, how does it make a tangible impact on our community, starting here at the lab and then going out to the services?
Well, several levels. Number one, we're addressing a lot of public health issues, and one of which has been infant mortality. And so advanced resuscitation skills in the rural community. We have a mobile element to our simulation lab, which will go in rural communities, hospitals, and actually train teams well beyond the Parkview borders, but also training internally staffed to prevent patient errors and improve quality of our own team. So the lab was built with that in mind as its key concept. And now we have a graduate medical education program, which is a residency. We're training young people on advanced skills, and they presumably, many of those people will stay in the community and will increase the pool of new physicians and healthcare professionals in our community. So that's really the concept. We've helped a lot of the educational institutions external to Parkview, the local universities, with their needs in that regards.
Yeah, it's so cool to look at the lab and really see it in 3D. And I know that you have been in the medical field for many years. How do you feel about the innovation and how technology has really taken a new way of curing diseases and helping solve medical issues in a more expedient way?
Well, I think new technology, as you might know, is a two-edged sword, right? So we have to know how to use it in a targeted way to improve care. And the only way to do that is what we call user design. And so we have a whole team of people that are experts in user design. And so testing patients of how they might use the technology as consumers, but also testing clinicians of how they might use technology to help deliver better care. So the team has expertise in that area, which has actually helped us be more thoughtful about applying technology to patient care. To your point, there's a lot of great new technology developed. How do we best use it and leverage it for patient care?
Yeah, that is so awesome. And I know that you focus on 3 different pillars to really focus back on that patient care that you talked about. Can you explain those 3 pillars?
Yeah, well, I think that the underpinnings of medicine is how do we advance the care for patients, and that has to do with research. And many of the research findings are from the basic science lab. So we call that translational research, where something that's discovered in the lab, such as messenger RNA vaccines in the laboratory, are translated from the bench to a vaccine that's delivered to a patient. So that is the element underpinnings of a lot of the advances in medicine, biotechnology, all the new treatments, particularly newer treatments for cancer with immunotherapy. That is classic bench to bedside. The immunotherapy solutions are just amazing. It's transformational for medicine, particularly with our Cancer Institute. We try to support some of the newer technologies that are coming out of that sector specifically. Another pillar, of course, the Advanced Simulation Center was built around the concept of professional education, of improving the performance of skills that are performed on patients and reducing, for example, variation in treatment.
Right.
An example was surgery. How do we reduce variation in surgery to reduce errors, but also improve the clinical outcomes? And then the innovation program is a gateway for new technology to come into our system. Our team has put together a process to look at new technology and see what they need to be successful, and for us to test it here in the clinical environment, again, the users, and see how we might use it best, but also that ends up helping the company commercialize their technology to improve care.
Okay, that's wonderful. You broke it down so perfectly. Thank you so much, Dr. Mirro.
No, thank you.
We appreciate it.
So wonderful to have you here and to expose this to the community, because it's a great asset for our community, but beyond that, for the state of Indiana and beyond.
Yes, absolutely. Thank you. And we have more to come at the Mirro Center, so I'll see you after the break.